The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 in Focus.
Hello, I'm Susan Shapiro. The U.S. Surgeon General is calling for warning labels on alcoholic beverages about the link between alcohol and an increased risk for 7 different types of cancer. They include breast cancer in women, colorectal, esophagus, voice box, liver, mouth, and throat. According to the U.S. Department of Health and Human Services, alcohol consumption is the 3rd leading preventable cause of cancer in the United States after tobacco and obesity. The department also says there are about 100,000 alcohol-related cancer cases and about 20,000 alcohol-related cancer deaths each year. Tonight, we're talking about the impact of alcohol on the body and whether addiction specialists think that warning labels are a good idea. We're putting the proposal to put warning labels on alcohol in focus. Joining us now is Dr. Jennifer Zampogna, an addiction medicine physician with Lancaster General Health. Thanks so much for being here.
It's my pleasure to be here.
What is it that alcohol is doing to your body that makes it a cancer risk?
So what alcohol does is when it's ingested, it actually is broken down into a chemical called acetaldehyde. And acetaldehyde is a known toxin. It causes free radicals and inflammation to form in your body, and it also directly damages DNA, so it significantly increases cancer risk. We've known this as healthcare professionals for many years. What we've realized recently in recent surveys is that only about half the American population associates alcohol with an increased cancer risk. And it is responsible for at least 100,000 cases of cancer every year, and 20,000 of which are fatal. We know that it actually increases significantly the risk of breast cancer in women, more so than other cancers in men and women combined. It increases the risk of oral cancer, esophageal cancer, colon cancer, rectal cancer, and especially liver cancer. So these are all issues that are first and foremost on our minds as addiction medicine physicians. But I think part of what the Surgeon General is trying to get across to folks in the last few months with his report is that the studies are incontrovertible. The data is there, that it is a carcinogen, and that truly no amount of alcohol is safe.
That's what I was going to ask you. How much is enough?
So FDA guidelines indicate no more than 1 drink a day for women, no more than 7 a week. No more than 4 in one setting. That's 2 drinks a day for men and no more than 14 a week for men. The reality is that even just 1 drink a day significantly increases your risk of cancer. Especially in women, it increases the risk of breast cancer. And about 16% of all breast cancer cases are directly attributable to alcohol intake. You don't have to drink heavily to develop cancer from alcohol. No amount is safe. But we do know that the more you drink, the higher your risk of cancer. Interestingly, it's not related to the form of alcohol. So whether it's liquor, beer, wine, they all have the same risk. It breaks down to the exact same chemical compound, which is a known carcinogen.
Wow. But obviously it's a risk a lot of people take. I know you have this lived experience as well.
Right.
Why is that people might be willing to take that risk?
Right, because of how it makes you feel. You know, it acts as a social lubricant, for lack of a better term. And for a lot of people, you know, we have stressors in our lives. We're a society that's built on instant gratification, and alcohol can be that instant gratification. Just like many things in our world, it's a very high-risk substance to use. It's not a medicine, it is a poison. The question is what risks are individuals willing to take knowing that? And I think the key is, as an addiction medicine physician, is my role is not to tell people what they should or shouldn't do. Don't drink, don't smoke. My role is to inform patients and the public of the risks and benefits of any particular substance so that they can make their own informed decision and moderate their own risk moving forward.
What benefits? I know you talked about it, it's a social thing, but what other benefits does alcohol have?
There were some studies in the past, and a lot of people hold on to this, although it's been essentially disproven, that a drink here and there may be good for your cardiovascular health.
Especially red wine, I know we've heard that.
Right, and the data is just not there to support that in observational studies and meta-analyses. the data is there incontrovertibly to support that it is a carcinogen and that it significantly increases your risk of cancer over a lifetime, not just in the long term, but also in the short term.
And obviously a lot of people you're dealing with cannot just limit their alcohol intake.
For about 1 in 10 people who develop an alcohol use disorder, cutting back, no matter how many times they try, they're unable to do so because of the development of a physical dependence, which happens in everybody if you drink enough for long enough.
Some people think you might have a higher tolerance if you drink a lot of alcohol.
Right, and so with tolerance comes the risk of severe withdrawal. As your tolerance increases and you can drink more, that also means when you stop drinking cold turkey, for lack of a better term, the risk of significant health problems is there in the short term for the first 24 to 72 hours. Patients who drink heavily for a long period of time and decide to stop cold turkey end up in ambulances on their way to the emergency room after having seizures. They can become delirious. Now, your average alcohol intake is not going to cause that, but these are the consequences that we see in the hospital frequently.
Of heavy drinking. Thank you so much. Appreciate your time.
My pleasure. Thank you.
Coming up on WGAL 8 in Focus, we'll talk with a doctor from the Caron Treatment Center, which helps people struggling with substance abuse.
This is WGAL 8 in Focus, coverage you can count on.
Joining us now is Dr. Ming Wang, who's the Associate Medical Director of the Caron Treatment Centers, which helps people who are struggling with substance abuse disorder. Thanks so much for being here.
My pleasure, Susan.
What was your reaction to hearing this latest warning from the Surgeon General about alcohol?
I was not surprised at this potential move by the Surgeon General because for many years, if not decades, we've always been aware that there are cancer that's attributable to alcohol use. And for the Surgeon General to consider placing a warning on alcohol, that may not be a bad idea.
Do you think that would help people? Would that encourage people to stop drinking?
It may help certain populations. Now, depending on which populations of alcohol users we're talking about, at Caron Treatment Center, we're accustomed to seeing alcohol users who are very progressed in the alcohol use disorder severe category as defined by the DSM-5 criteria. In that population, Susan, I'm not certain that even the warning label would deter them from continued use of alcohol.
What are those criteria?
The DSM-5 criteria for alcohol use disorder consists of 11 criteria. Depending on how many of those criteria the individual meet, it would place them in the mild, moderate, or severe category. So for someone to be placed in an alcohol use disorder severe category, it would require them to have 6 or more of those criteria.
Do you see in your patients evidence that there might be a link to cancer? Patients who might have, say, liver cancer or other cancers that have been linked here?
Absolutely. I am accustomed to seeing end-stage liver disease at Caron Treatment Centers. And in that population, there are suspicion of liver cancers. While working up for their liver disease, sometimes nodules are seen on the CT scan and for these heavy alcohol consumers. So certainly that there are suspicion that, yes, at our facility, seeing cancer that might be attributable to alcohol use. And
of course, there's others on this list, breast cancer, other things you may not think that there was a link.
Absolutely. We've known that alcohol potentially could lead to certain cancer, like esophageal cancer, stomach cancer, oral mouth cancer, and breast cancer as well. And those are probably some of the top cancer that might be caused by alcohol use.
In your patient population, are you finding there is a link with alcohol use and somebody's metabolism or their makeup?
Yes, we are very aware of that also, not only by age, but also by gender. Men and women respond to alcohol very differently. Younger individual respond to alcohol very differently from an older adult. And that's due to their physiologic makeup and differences also in the physiologic makeup, in addition to changes in the physiologic makeup as one gets older.
Obviously, some people can consume alcohol and not consume it or have it, but others it become very addictive. Why is that?
That is very variable. Some people could consume a lot of alcohol on the average and not seemingly be impacted by that amount of alcohol use. And some people could drink a fraction of that and be impacted dramatically. And this has to do with their genetic makeup as well. There's, for example, Susan, there's a certain enzyme in our body called acetaldehyde, and not only are there gender differences, but there are also ethnic differences in this particular enzyme. So acetaldehyde is not kind of toxic to the human body, and depending on the variability of this particular enzyme in the body, it will, the end result is how will impact the person's response to their alcohol use. Women tend to have less acetaldehyde enzyme available, so the breakdown of alcohol is not as efficient, and so alcohol would impact women more, as well as certain ethnicity, for example, Asian population, right?
They just break it down differently.
Yeah, break it down differently. So same amount of alcohol consumed might affect an Asian person much more than, let's say, a non-Asian person.
Interesting. Well, let's talk about some of the treatment that is available and how it is helping people when we come back.
This is WGAL 8 in Focus, coverage you can count on.
We continue our conversation with Dr. Ming Wang, who's the Associate Medical Director from the Caron Treatment Centers. Again, thanks for being here. Why is alcohol so addictive and so hard to kick the habit for some people?
Alcohol is a mood-altering agent, similar to other mood-altering agents such as opioids and sedative hypnotics. And people enjoy alcohol because it changes the way they feel. And that's fine and all, because many people enjoy alcohol in moderation with friends and family. However, for those who might be predisposed to alcohol use disorder, perhaps their genetic makeup is a little bit different. Enjoying alcohol in moderation potentially could lead to dependency on that alcohol.
How do you know if you're dependent?
That's a good question, and someone who might be dependent may find themselves difficult to control their alcohol use when it becomes problematic. They fail attempts to control or stop altogether, and which is one of the big indicators, not the only one, but one of the main indicators of maybe there's a problem with their drinking habit.
So if there is a problem, what kinds of treatments are the latest kinds of things out there now?
Treatment for alcoholism is very abundant in this country. And Caron Treatment Center, for example, we do treat a lot of people with alcohol use disorder, especially in the severe category. It really is to help our patients develop the understanding of what recovery is, to provide them with recovery tools and learn how to use those tools once they get back home into their community. So
what are some of those tools?
So those tools are understanding what their co-occurring issues are, what triggers their alcohol use perhaps. Is it to mask some of their mental health or mask their mood dysregulation such as depression and anxiety? Or they simply just enjoy the effect produced by alcohol, that buzz, right, Susan? Yeah, and so to help our patients understand that part, and then give them the tools of recovery and teach them how to use it.
Yeah, not easy, I guess.
What
is the recidivism rate?
The recidivism rate, or the relapse rate, for alcohol use is fairly high in this country. It's upward of 60% of those who are treated the first time. At Current Treatment Center, our statistics seem to be a little bit better, but still we work to try to prevent our patients from relapses by giving them solid treatment and a solid aftercare plan once they go home.
So often it might take more than one time in rehab?
For many people, perhaps they need multiple rehabs, and the hope is that each rehab episode would add to what they already know already.
So for some, I imagine this is a lifelong battle.
Recovery is a lifelong process. Recovery is a way of life. It never stops.
So do you have to change your whole lifestyle or the people you are surrounded by?
Some aspects of a person's life may need to be changed, but it does not have to disrupt their whole entire life. The whole idea of recovery is healing, right? It's healing, it's mending broken hearts, not just for the individual consuming alcohol, but for the loved ones around him, so that they all could live a functional and quality life together.
Yeah, so, but again, not easy, is it?
The rules are very simple, Susan, but sometimes it is difficult to carry out those skills.
What's the number one rule you give patients?
In my opinion, the number one rule to having solid recovery is to follow directions. Follow directions from your healthcare provider, follow directions from your treatment center, aftercare treatment providers, and perhaps your recovery support community.
And can people who are in recovery be around alcohol or others who are drinking? They don't certainly have to segregate themselves totally.
Right, certainly they could. What we recommend at Current Treatment Centers, perhaps in early sobriety, and that's within the first year of sobriety, perhaps avoid those people, places, and things that might trigger their alcohol use. And right now, Susan, for example, football is going strong. And many people love drinking while they're watching football, so that would be one of those triggers that we would caution people.
What about non-alcoholic beverages that are very popular right now, mocktails and things like that?
Absolutely not, Susan. And some of those non-alcoholic beverages that are advertised do contain a small amount of alcohol, but even if they had zero alcohol content, it's the taste and the flavor and the smell. Addiction and alcoholism is a brain disease, right? And when that part of the brain that's responsible for addiction and alcoholism, when it's activated, even by smell and taste, that may result in a true relapse.
And certainly some people might be replacing marijuana or other forms of drugs in place of alcohol.
Yeah, we discourage that also because, again, addiction and alcoholism is about changing the way one feels. And those other agents are mood-altering agents also, which changes the way a person feels, which may, again, lead back to their original substance of choice.
All right. Well, thank you so much. Appreciate you sharing.
My pleasure.
Coming up on WGAL 8 in Focus, we'll talk with a woman who's in recovery from alcohol addiction.
This is WGAL 8 in Focus, coverage you can count on.
Joining us now is Tina. She's been in recovery from alcohol 4 years now.
Correct. Yes.
That's great. Well, congratulations for that.
Thank
How did you get addicted to alcohol?
So it was a slow progression for me. I had my first drink when I was probably 13 or 14 years old. It was something just, like being a teenager in a small town, we would do occasionally. And then into my 20s, I drank pretty normally, like socially. As I got to be older, I had 2 daughters. I was very involved in their activities because I was a stay-at-home mom. And as they got older, I started feeling less and less like needed by my kids, and I was still a stay-at-home mom. I started doing lunches with friends, drinking more frequently. That turned into drinking daily. That turned into being more sneaky about my drinking. And as I was approaching my later 30s, early 40s, it really turned into a problem. I didn't feel it was a problem, but it was definitely affecting my family, relationships, things like that. And it just eventually got to the point where I was in such denial because the alcohol had taken such a hold on me. I didn't even realize what was happening, and it just eventually led to
I was beyond the point of helping myself and stopping.
So there was an intervention and you went into recovery?
There was, yes. There was an intervention. It was the best thing.
What do you think when you hear the Surgeon General talking about alcohol and the risks for cancer, 7 different types of cancer?
I think that makes sense. It's not something that when I stopped drinking I was really aware of or heard a lot about. I mean, I know there's obviously negative effects. I myself didn't feel good most days unless I had a drink. Ironically, having a drink made me feel better. The cancer absolutely makes sense to me. Again, it's just not something I know a lot about.
Do you think knowing about that risk would be a deterrent?
For me, no, it would not have stopped me because, like I said, when I got to the point that I was drinking every single day, almost round the clock, nothing could have stopped me. People tried to help, get involved, and I just needed it. I needed it to get through my day, and reading a warning label that said this can cause cancer, for me, would not have helped. It's possible someone who's just a social drinker, that could be helpful for them, but a true alcoholic, I do not believe, in my opinion, it would make a difference.
But certainly good to educate people about those risks, that's for sure.
Yes, absolutely.
How is it now that you've been, clean
ever.
for 4 years, you said?
Yes, in December it was 4 years. The thing I say a lot is I didn't know what I didn't know. So I had that stigma, that idea of, what it meant to be an alcoholic. You picture someone with a brown paper bag begging for money, and I was like, I'm not that. That can't be, my life. And so once I had that intervention done and I got to a treatment center, Karen, and I started being educated on the disease of alcoholism, and I realized I'm not alone and it's okay to not be okay. It just opened this whole new door for me to recovery. And I just jumped in both feet, and got right into a program as soon as I left Karen, and my life is beyond what I ever could have dreamed.
Is it tough now? I mean, alcohol is everywhere. It's now, as we're saying earlier between us, the grocery store and the convenience stores.
Yeah, it's crazy to me. It wasn't quite like that when I quit drinking 4 years ago. It doesn't bother me, except the fact that it is so easily accessible for people, and so many people like me that might have a problem, that I know what I would have been doing when I was drinking. I would have been hitting all those convenience stores. I've been grabbing it at the grocery store every single time I went. So I don't know, I think that could be an issue for alcoholics or people who are struggling.
Well, thank you so much for sharing your story, and congratulations to you. And
thank you so much.
Thanks for being here.
Of course, thank you.
If you or someone you know needs treatment for substance abuse disorder, the state has a toll-free hotline. You can call PA Get Help now at 1-800-662-HELP. That's 1-800-662-HELP. It's available 24 hours a day, 365 days a year, and is staffed by trained professionals. Thank you for joining us for WGAL 8 in Focus. For all of us at WGAL, I'm Susan Shapiro. And join us again next Saturday night at 7 o'clock for WGAL 8 in Focus, right after NBC Nightly News. And you can watch each episode of In Focus, plus WGAL's latest newscast, original programming, and more. Just download the Very Local app and stream for free on Roku and Amazon Fire TV.